Okay, now we are good, right? I hope I've done justice to the topic now. So now we can finally move on to hanging. All right. What is hanging? Definition. Hanging is asphyxia. It is mechanical asphyxia due to neck compression. Due to neck compression, the compression of neck is by a ligature, which is around the neck, and for the ligature, the constricting force is the weight of suspended body. See, this right here, this thing is your ligature. If I wrap this ligature around my neck, right, and then suspend myself on the ceiling, then due to the weight of the suspended body, this ligature will compress around my neck and this will eventually lead to asphyxia. So hanging is asphyxia due to neck compression by a ligature around the neck, for which the constricting force is the weight of the suspended body. What is the mechanism of death? See, since in hanging the neck is getting compressed, let me draw the transverse section of the neck. When I draw the transverse section of the neck, I get the esophagus. Right in front of the esophagus is your trachea. Here's the trachea. And behind the esophagus is the cervical vertebra. No bueno, cervical vertebra. And at the tracheoesophageal groove, this right here, is the carotid sheath. On either side, carotid sheath, and both of them contain the carotid artery, which is medially, the jugular vein, which is laterally. Whoa, where did the carotid artery go? And then vagus nerve posteriorly. So when the neck is compressed, each one of these structures get compressed depending on how much force is constricting the neck. So most superficially, you have the jugular vein. So the compression of the jugular vein requires only 2 kg of force. Medial to that is the carotid artery. And the compression of the carotid artery requires a little more, that is 5 kg of force. Then posteriorly is the vagus nerve. Give me a straight line. There's your vagus nerve. So your vagus nerve can get compressed as well. Then here is your trachea. The compression of trachea, the tracheal compression, requires more force, around 15 kg. And finally, there's your cervical vertebra. Vertebral compression requires a lot more pressure, around 30 kg of force. Now, the compression of each one of them lead to death by different mechanism. For example, if a jugular vein is compressed, this is going to lead to cerebral congestion. Pretty logical. Jugular vein is compressed, the venous return is blocked, the face and neck is pooled with deoxygenated blood, the cerebrum is pooled with deoxygenated blood, there is cerebral congestion. Carotid compression. If you compress the carotid, the arterial supply to the cerebrum is cut off, leading to cerebral anemia or cerebral hypoperfusion. Similarly, if trachea is compressed, the airflow is inhibited. If vertebra gets compressed, it will lead to the fracture of the vertebra. And if vagal nerve gets compressed, if vagus nerve gets irritated, it will lead to vagal inhibition of heart. Now, Out of all these mechanisms, the most common mechanisms for the death by hanging is these two. Most common mechanism of death by hanging. That is the tracheal compression leading to airflow obstruction and the jugular vein compression leading to cerebral congestion. Good, good. So we are done with the definition, we are done with the mechanism. Now we need to understand the various types of hanging. First, we have on the basis of degree of suspension. See, you can look in this picture. In A, it's the complete body of the person that is suspended or hanging. In B, only parts of the portions of the body is suspended. It's not the complete body is suspended, and here none of the body part is suspended. If there is complete suspension, we call it complete hanging. If there is partial suspension, we call it partial hanging. The differences are, in complete hanging, it's the complete body that is suspended. In partial hanging, only parts of body is suspended. In complete hanging, there is no contact of the body with ground. In partial hanging, certain parts of the body are in contact with ground. In complete hanging, the constricting force is the complete weight of the body. In partial hanging, it's the partial weight of the body, only the weight of that part of the body that is actually suspended. Since in complete hanging the constricting force is larger, it's the weight of the whole body, the duration of death is also faster. Since in partial hanging the constricting force is less, it is only the part of the body that is suspended, so the duration of death is also slower. Next is on the basis of position of knot. If it is on the occiput, right here, then that's typical hanging. If it is anywhere else other than occiput, then that is atypical hanging. So typical hanging is when there is knot at occiput. Atypical hanging is when there is knot anywhere else other than occiput. For example, it can be submental, just below the mental, or it can be at the jaw angle below the ear, jaw angle, or anywhere between submental and jaw angle. See, on the basis of manner of death, hanging can be a cause of suicidal death or homicidal death or accidental death. And in fact, it is the most common method of suicide. The second most common being poisoning, homicidal. Now, under homicidal as well, you have two types. You have judicial hanging and non-judicial hanging. Under judicial hanging, you have the judicial hanging, and under non-judicial hanging, you have lynching. So you might have seen in movies, or you might know from your concept of law about judicial hanging. In judicial hanging, the person is stood on a platform, he puts his head inside the ligature, and the platform then opens such that the person drops down and starts hanging. Okay. In judicial hanging, the knot is ideally submental, but in India, the knot is at a jaw angle. What is lynching? So lynching, it has a really bad history. So lynching refers to someone being hung in the public, in a public setting. So you can see here's the public, and then here's the person who has been hung. So there's the history of African American or black people in general being hung for crimes that they are accused of. Now, these crimes that they are accused of were usually really petty, small crimes, or sometimes, or most of the times, those were just false accusations. And obviously, due to racial profilation and racial injustice, they used to be hung, and then people used to celebrate this. That was lynching. Okay, next is accidental. The example of accidental is autoerotic asphyxiation. Now, this is really interesting. Okay, I want you to concentrate in this topic, or even if you don't concentrate, I know for a fact if I start explaining about autoerotic asphyxia, your concentration will increase on its own. Autoerotic asphyxia. Yes, as the name says, here the person is asphyxiating himself for sexual gratification. This is also referred to as sexual asphyxia, asphyxiating himself for sexual gratification, or asphyxiophilia, loves asphyxiation, or hypoxiphilia, loves that condition of hypoxia or cerebral anemia or cerebral ischemia, or coxwarism. Now, this word has a history of its own. I want you to check it out. This gives you the history of the very first recorded event of autoerotic asphyxia. Pretty interesting story it has. Okay, so let's look at the mechanism behind it. How exactly does a person get aroused by asphyxiating himself? So there is partial neck compression, due to which there is cerebral hypoperfusion. Why? Because the carotid has been obstructed, so there is less flow of blood in the brain, which leads to cerebral transient ischemia, temporary ischemia, and this transient ischemia provides hallucinations, and hence sexual gratification. And after receiving sexual gratification, the person then loosens the ligature. Okay, but sometimes this is what happens. The person ties himself with the ligature. There is cerebral ischemia. This person gets hallucinations and then sexual gratification. Then he loosens the ligature. Then he breathes in. Okay. Again he tightens the ligature. Again there is cerebral hypoxia and then sexual gratification, and then again he loosens the ligature. He does that again and again, and then enjoys himself, gets all the sexual gratification he can receive. When all of a sudden he's now unable to loosen the ligature. It's stuck. Now it's no longer about sexual gratification, it is about life and death. It is stuck, right? So he tries to loosen the ligature, but it is stuck. So he ends up killing himself accidentally. This is your accidental hanging. So fails to loosen the ligature. Usually in such cases, if you look at the surrounding, you will find four things. Number one, a naked body, because the person is trying to get sexual pleasure. Number two, some pornographic stuff around. Number three, no suicide note. If it were a suicide, he would have written a note. And number four, probably transvestism. Transvestism is when a male wears female cloth and a female wears male cloth. So you can look at the site. There's the naked body, there's the evidence of pornographic material, and there's no suicide note. And this is kept under something called masochism. Masochism is where the person enjoys himself or gets sexual gratification or gets sexual pleasure by inflicting pain on himself. inflicting some sort of pain or embarrassment, all that stuff. That's masochism. All right. So those were the various types of hanging. Number one, on the basis of suspension, you have complete hanging where the total body of the person is elevated or suspended, or incomplete hanging where the body is hanging partially, that is, some part of the body is in contact with the ground. Number two, on the basis of knot, you have typical hanging where the knot is at the occiput and atypical hanging where the knot is everywhere else other than the occiput. And then on the basis of manner of death, suicidal, which is the most common method of suicide, homicidal like judicial hanging or lynching, and accidental where you have autoerotic asphyxia. In autoerotic asphyxia, the person asphyxiates himself in order to gain sexual gratification or sexual pleasure from cerebral hypoperfusion, from cerebral transient ischemia. But while doing so, sometimes eventually he fails to loosen the ligature and ends up hanging and killing himself. Okay, next, post-mortem findings, which this is even more important for you to know. Post-mortem findings, they are divided into two: the external findings and the internal findings. The external findings, you can just see them. Internal findings, you need to carry out autopsy, that is, you need to cut open the body. In external findings of hanging, you need to first look at the face, then look at the neck, then look for hypostasis, and then look for external signs of asphyxia. Starting off with the face. In the face, number one, you look at the appearance of the face. Appearance. The face can either be pale or congested. It is pale if the carotid gets compressed, because that will lead to reduced oxygenated blood, and then hence there's pale, requires around 5 kg of force. Congested when jugular vein gets compressed, because if jugular vein is compressed, there is inhibition of return, and then that leads to congestion with deoxygenated blood, requires around 2 kg of force. B, after appearance, that is this overall color of the face, you look at drooling of saliva. Drooling of saliva. And very important, this is the surest sign of ante-mortem hanging. See, as a forensic medicine expert or a detective, you need to be able to differentiate between ante-mortem and post-mortem hanging. The person could have died because of hanging, that is, he was alive before hanging, that is ante-mortem hanging. Or the person could have been killed and then hung with a rope, that is post-mortem hanging. So to differentiate between the two, there are certain signs, and these are the signs. The first one and the surest one being the drooling of saliva. So this is what happens. When the person hangs himself, right? The person is alive and now he hangs himself. What happens is that on the dependent side, for example, I am hung like this. This is the dependent side. On the dependent side, the submandibular gland gets irritated and there is excessive production of saliva, and then this saliva drools out of the mouth. Now, depending on which position my head is tilted towards while hanging, the saliva will drip on the same side because of gravity. So if my head is like this, the saliva will drip like this. If my head is like this, saliva will drip like this. If my head is like this, the saliva will drip like this. So that's the surest sign of ante-mortem hanging, drooling of saliva. Why is there drooling of saliva? Cause of the irritation of submandibular gland on the dependent side. See, let's say I was killed before and then my body is hung. Now, no matter how much pressure is exerted on the submandibular gland, it's dead. There's not going to be production of saliva. There's not going to be any drooling. Number C, protrusion of tongue. Protrusion of tongue. During hanging, the pharyngeal apparatus gets lifted up, resulting in protrusion of tongue due to the elevation of pharyngeal apparatus. Number D, lay facie sympathecae. Now, this is also a sign of antemortem hanging. Remember, the surest sign is drooling of saliva, the surest sign, but this is also a sign. What happens in lay facie sympathecae is that, see, again I am hung. Today I am being hung way many times. Okay, gotta do this much in order to teach you, right? Okay, as I am hung, again on the dependent side, not just the submandibular gland gets irritated, but the cervical sympathetic chain gets irritated as well. As a result, there is opening of the eye and the dilation of the pupil on the ipsilateral side of the same side. See, the dependent area basically refers to that area of the neck that is receiving the actual pressure, the most pressure. That could be here, or maybe if the knot is fixed here, it could be at the site of knot. Okay, with that being said, again, so on the dependent area, either both the submandibular gland is irritated and the sympathetic cervical chain is also irritated. So here what happens? There is irritation of cervical sympathetic chain that results to opening of eye and dilation of pupil on ipsilateral, that is the same side, ipsilateral side. Okay, see here. So this is the revision for you guys. You can see that the face is pale because the carotid arteries have been obstructed or compressed. Second, you can look at the protrusion of the tongue. Protrusion of tongue. Third, you can look at, let me draw here, dribbling of saliva, the drooling of saliva. Drooling of saliva. And then you can look that the eye is open and the pupil is dilated on the ipsilateral side where the knot is putting pressure on, right? This is referred to as lay facie sympathecae. With that, we are done with the face findings. Next, the neck findings. On the neck, due to ligature, you get ligature mark. And what is a ligature mark? If you have seen my video on mechanical injury, you can say fatafat that ligature mark is ligature abrasion, which is nothing but a pressure abrasion. What is pressure abrasion? Pressure abrasion is abrasion due to perpendicular force where the force is less for a long period of time. I won't explain that here. That was supposed to be remembered by you after watching my mechanical injuries video. Okay, so you get pressure abrasion. Now, the characteristics of pressure abrasion depends on number one, or the characteristics of ligature mark depends on number one, the material used. The material can either be soft and wide. For example, dupatta, it is soft and wide. So the ligature mark is also superficial and wide. Or it could be hard and thin, like a wire. Then it would be, the mark would be deep and narrow. This is also referred to as cheese cutter method. Okay, let me show you some of the materials that can be used as ligature. You can use soft material, which will give you superficial mark, and a hard material, which will give you a deep mark. Soft material like bedsheet, dupatta, sari, any piece of cloth. Hard material like electric wire or rope. So first, was your material. Second is your knot and nose. There are two types of knot and nose. Number one is a slip knot with runny nose. Just hear me out, I'll explain you. Slip knot with a runny nose. Number two is fixed knot with fixed nose. Fixed nose. Question number one. What is a knot? What is a nose? So this right here is the knot where the ligature has been tied. And the rest of the ligature around your neck is the nose. Good? Good. So first is a slip knot with a runny nose. So here what happens is that, so here's the ligature around the neck and the knot right here is a slip knot. As a result, when you hang yourself, due to the weight of the body, the slip knot, it slips downward. See, it's slipping downward. As the weight is being exerted, it's slipping downward, slipping downward, slipping downward, slipping downward, slipping downward, and eventually it wraps around the neck like this. It wraps around the neck like this. See what has happened? Two things has happened. Number one, the ligature is wrapped completely around my neck. Is there any gap? No. Number two, the ligature was like this. But then as the slip knot slipped down and the noose ran around my neck, it became transverse. So it's now transverse and complete. So slip knot with runny noose gives complete transverse ligature mark. Okay, another. This right here has a fixed knot with fixed noose. That means if I hang myself, it's not gonna slip down. And if it's not gonna slip down, it's gonna be, the ligature is gonna be oblique. Okay, let me show you from the side. The ligature is gonna be oblique and there's space in between, that is incomplete. So this results in incomplete oblique ligature mark. Number C, the color of the ligature mark. First, the ligature mark is pale due to lack of blood supply. Eventually, it becomes dark brown, parchment-like. Okay. Now, a ligature mark due to hanging most of the times possesses these characteristics. Number one, it is oblique. Number two, it is incomplete. Because most of the times the person, they use a fixed knot with a fixed nose, right? Fixed knot with a fixed nose because it is easier to make. People don't know how to make a run, you can just slip knot with a runny nose, right? They know how to make fixed knot with fixed nose. As a result, when they hang like this. So as they hang like this, they get a oblique ligature mark and an incomplete ligature mark. Number three, there is suspension peak with the ligature mark as well. Suspension peak. What is suspension peak? So at this point you can see that the ligature mark is going obliquely up, and then there is a gap in between, and then it looks like an inverted V. So this shows the point of suspension of the neck. So just like here, this is where the knot is tied, and then here's the ligature, giving us this inverted V and showing exactly the point of the neck where the suspension of the body takes place. This is referred to as the suspension peak. This is the site of knot, the site of suspension. Okay, so it's oblique, it's incomplete, and it has a inverted V like suspension peak. But then there are conditions where you get transverse ligature mark. And there are two conditions where you get transverse ligature mark. Number one, when you have a slip knot with runny nose, as I showed earlier, slip knot with runny nose. And number two, when the point of suspension is low. See, this is fixed knot with fixed nose. Okay. Oblique, oblique, अरे भाई, oblique, 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 transverse. So when the point of suspension is low, you get a transverse ligature mark, no matter the type of knot or ligature is used. So low point of suspension. I missed one point. See, number 4. In hanging, the ligature mark is above the level of thyroid. Above thyroid. Why? See, even if I ligate myself below thyroid, due to the gravity and the weight of my body, the ligature will eventually slip above thyroid. See here, what is this? This is a fixed knot with fixed nose. And what has it given us? It has given us oblique incomplete ligature mark. What is this? This is a slip knot with runny nose. What has it given us? It has given us a transverse, transverse complete ligature mark. What is this? This doesn't matter the type of knot or the type of nose, whatever, but then it has a low point of suspension. Both of them have high point of suspension. This has a low point of suspension. Due to which you get that transverse ligature mark. All right. Hypostasis. You get glove and stocking hypostasis. Hypostasis is basically the collection or pooling of blood in the dependent part of the body after death. When you hang yourself after death, you are vertically hanging. Okay, you are vertically hanging. Due to which, due to gravity, there is pooling of the blood in the hands and legs, giving glove and stock appearance. But remember, glove and stock appearance does not tell you the cause of death. Just because after death a body has glove and stock appearance, that doesn't mean that the cause of death was hanging. A person could have been killed by, let's say, throttling, strangulation, and then hung. In that case also you will get glove and stocking appearance. That is because of the vertical positioning of the body. That doesn't mean he died of hanging, he died of throttling, but then due to the vertical positioning of the body after death, there is glove and stocking appearance of hypostasis. And then signs of asphyxia, which includes your Troudot spots, the external finding, and cyanosis, the external findings. And with that, you are done with the external post-mortem findings of hanging. So first, you saw the face. Number 1, pale or congested. Number 2, laugh sympathetic. Number 3, drooling of saliva. Number 4, protrusion of tongue. Then you saw the neck, which had the ligature mark. The ligature mark depends on the material, it depends on the knot and the nose. Then hypostasis, and then the signs of asphyxia. Next, internal findings. But before getting into the internal autopsy findings, number 1, let's say you found your victim hanging on the ceiling like this. This rope that has been used, knot and noose, is a important evidence for you, and you need to preserve this, because this will tell you whether the death actually took place by hanging or was he killed by strangulation or some other and then hung. Lots of things. Okay, how will you preserve this? The knot is very important, because the knot will tell you the type, runny, slip knot or fixed knot, and many other information. So you need to preserve the knot. In order to preserve the knot, you cut the noose farthest away from the knot. And what is farthest away from the knot? Right opposite to the knot. Right opposite to the knot is the farthest away from the knot. So you cut at this point, kachak. After cutting, you will get the 2 split ends. You tie them together with the help of a separate thread. Plus you also tie the knot with a separate thread to preserve the knot. So you cut opposite to the knot and then you tie the two ends together with the help of a thread, and you also tie the knot with the help of a thread to preserve the knot. This is how the ligature is preserved as an important evidence when you find a hanging case. Second, how is the neck opened? See, in case of hanging, neck compression, while carrying out autopsy, the neck is always opened last. See, number one, the head opened, the abdomen opened, right? You pull the brain out, then you pull the viscera out, and then only do you dissect the neck. The question is why? For a bloodless dissection. Bloodless dissection. See, hear me out. Number one, number A, bloodless direction. In case of neck compression, the jugular veins are compressed. And if you go ahead and incise and cut the neck first, the jugular vein will rupture and there will be lots of bleeding in the neck. As a result, the evidences, they won't be appreciated easily. So what you do is you first open the head, remove the brain, that will decompress the compressed veins. Similarly, open the abdomen, remove the visceral organs, again decompress the compressed veins. And then when you open the neck, there is no longer compressed veins, the veins have been decompressed, they are relaxed. So you get a bloodless area in the neck. This is referred to as bloodless dissection. Number two, to avoid Prinsloo-Gordon artifact. What is Prinsloo-Gordon artifact? See, when there is neck compression, there might be trauma to the larynx. And when you look at the anterior or the lateral wall of the larynx and there is bleeding, that is because of trauma by neck compression. But sometimes you will find such bleeding just behind the esophagus in the posterior surface of esophagus as well. But that, my friend, is not due to neck compression. That is just an artifact referred to as Prinsloo-Gordon artifact, and it might be mistaken to trauma. So your end whatever conclusion you come up with might be disturbed by the Prinsloo-Gordon artifact. So to avoid Prinsloo-Gordon artifact and to carry out a bloodless dissection, you dissect the neck at last. And what type of incision do you apply? You apply either a Y incision or a modified Y incision while carrying out the dissection of the neck. This right here is bleeding behind the esophagus and a Prinsloo-Gordon artifact which can be avoided by bloodless dissection. Okay, now let's look at the internal findings. Remember, for neck compression, internal autopsy findings, they are always under the same headings. They are always under the same headings, and they are from outside to inside. So you already saw skin with ligature mark in external finding. Remove the skin, you get subcutaneous tissue. Remove the subcutaneous tissue, you get the neck muscles. Remove the neck muscles, what do you get? You get bones and cartilage of the larynx, bones and cartilage. Remove the bones and cartilage, what do you get? You get the inside of the larynx. So that's how you analyze it. So the internal finding is first in the subcutaneous tissue. In hanging, the subcutaneous tissue becomes white and glistening. Number two, you remove the subcutaneous tissue, you will get the muscles, the neck muscles. Now, there is rarely contusion or hemorrhage at subcutaneous tissue or muscle. Because as I said earlier, in hanging, there is less pressure or less force for a long period of time. Contusion and hemorrhage in the muscle of the neck or the subcutaneous tissue is seen in case of strangulation. where more force is being applied. Here, less force is being applied. So in the muscle of the neck, you don't really find contusion or hemorrhage. Then you remove the muscle. What do you get? You get the hyoid bone. You get the thyroid cartilage. And then you get the cricoid cartilage. First, the hyoid bone. The hyoid bone shows fracture at greater cornua. Greater cornu fracture. But this is only in 15 to 20% of the cases. And only when the person is more than 40 years of age. Because at less than 40 years, it is more cartilage. And cartilage, they don't break easily. So here's the greater cornu of the hyoid bone. This gets fractured. Important thing that you need to know is that you can find three types of fracture within the greater cornu of hyoid bone. 1, 2, 3. The three types of fracture. Number 1 is adduction fracture. Adduction fracture is when the fractured part, they move inside. And this is seen not in hanging, but in throttling or manual strangulation. Very simple logic. In throttling or manual strangulation, your neck is being pressed inward. By the hand, it's being pressed inward. So obviously, when the bone fractures, it will move inward. Then there's abduction fracture, where the fractured greater cornua, they move outward, both of them. This is seen in hanging. And the third is side-to-side fracture. Side-to-side fracture, both the fractured ends, they are to one side, either this side or this side. And this is seen due to swaying while hanging. So when the body swings while hanging like this from side to side, the bone, they also move to one side. Next is thyroid cartilage. So thyroid cartilage fracture is at superior horn. Cricoid cartilage rarely fractures. It doesn't really fracture. It is only when extensive force is applied, extensive force. So this is seen more in throttling rather than hanging. More in neck compression, throttling by hand, right, rather than hanging. Then you remove that, you get what? You get the larynx. Inside the larynx, there might be hemorrhage. And if there is hemorrhage, it's on the anterior/lateral surface. Then it is not Prinsloo-Gordon artifact. Again, more common is the subcutaneous tissue with whitened glistening and hyoid bone and thyroid cartilage fracture. These are less common. You can see right here, the greater cornu has been fractured, the superior horn has been fractured. Okay. Are we done with the internal findings? No. There is a special type of finding where the internal findings are even more severe. Here you get severe findings, and that is hanging from a long drop. For example, in judicial hanging, as I mentioned earlier, in judicial hanging, the platform over which the person is opens and the person hangs suddenly or drops down suddenly. Let me explain in another way. Let's say a person climbs a tree, he's on a branch, he ties his neck with the ligature and then wraps that ligature around a tree branch. Then he jumps. As he jumps, eventually he will hang, but then he will hang after a long drop. Due to this long drop, what is there? There is a sudden jerk on the neck, sudden pressure on the neck, sudden force on the neck. And this can result in either vertebral injury and carotid injury. In vertebral injury, you have two: injury of the cervical vertebra and the injury of the lumbar vertebra. In the cervical vertebra, you get hangman fracture. hangman fracture is nothing but the fracture of C2, C3, C4 vertebra. And the fracture is at pars interarticularis. Interarticularis. See, these are the cervical vertebra. These cervical vertebra are connected to one another or joined to one another with the help of a body called pars interarticularis. Pars means body, inter means in between, articularis means joint. So it's a body that joins in between the in between these cervical, in between the vertebra from behind. So as this joint gets fractured, obviously the vertebra is gonna become unstable. That means it will slip easily, and there is slippage of vertebra. There is slippage of vertebra. This is referred to as spondylolisthesis. So there is fracture at pars interarticularis with slippage of vertebra, referred to as spondylolisthesis. Remember, C1 never gets fractured. It's only C2, C3, C4 that gets fractured. C1 never gets fractured. Most of the time it's C2 that gets fractured, and then C2 slips over C3. Another. This is at lumbar vertebra. At lumbar vertebra, there is no fracture but hemorrhage, referred to as Simon's hemorrhage. Here's the lumbar vertebra, here's the lumbar vertebra, here's the lumbar vertebra, L1, L2, L3. In between are the vertebral disc. In these vertebral disc, anteriorly, hemorrhage takes place. You can see right here. Here's the vertebral body, lumbar vertebra, lumbar vertebra, lumbar vertebra. In between are the intervertebral disc, and anteriorly there's hemorrhage on the intervertebral disc. This is Simon's hemorrhage. What about carotid injury? In carotid injury, you get the Amuset sign. Amuset sign is nothing but a transverse laceration in the carotid intima. And with that, we are done with hanging. So what are the internal findings in hanging? So from outside to inside, remove the skin, you get subcutaneous tissue which is white and glistening. Remove the subcutaneous tissue, you get muscle where there is rarely ever any contusion or bleeding. Remove the muscles as well. Then you get the thyroid bone which is broken at superior horn. You get the hyoid bone which is broken at greater cornu, and it is broken in case of greater than 40 years of age, because less than 40 years it is cartilage only in 15 to 20% of the cases. And the type of fracture is abduction fracture or side to side fracture. And then cricoid cartilage not really broken. Larynx, there might be hemorrhage. Then hanging from a long drop, you get vertebral injury. Number one, cervical injury where there is C2 or C3 or C4 fracture at pars interarticularis with slippage called spondylolisthesis. And at lumbar vertebra, there might be hemorrhage which is referred to as Simon hemorrhage. And in carotid artery within the intima of the carotid, there might be transverse laceration referred to as Amuset sign.